Laser therapy is one of the modalities we use at our office to help accelerate the healing process and decrease pain and inflammation. So a common application we'll use the laser therapy for is lower back pain. We treat a lot of lower back cases, and it could be anything from a sprained strain to a herniated or bulging disc or even sciatica. So the nice thing with the laser therapy is there's protocols for all different areas in the body. So what I'm going to do is I'm going to demonstrate what it's going to look like for the lower back, and then I'll talk about some of the other applications we use it for. So we're going to basically select the lower back protocol. In her case, we're selecting the sciatica protocol. And how it works is we're going to place the laser over her lower back. She's going to feel just a very mild, warm, soothing sensation in her lower back. It doesn't hurt, doesn't feel anything really too hot or anything like that, but it feels very comfortable and it relieves a lot of the pain pretty quickly. So we're going to apply it on her lower back. And what you'll see is a little red light in the area where I'm applying the laser. That's showing you where the laser is actually going to be going. And we're basically going to trace the whole lower back where her problem is and just go back and forth like that. Now this protocol we're doing lasts about 6 to 7 minutes, and we're going to treat the whole lumbar spine. And again, what the patient will feel is just a really deep, soothing, warm sensation. Feels really comfortable and will help to relieve her pain and accelerate the healing process. What's also great about the laser therapy is you can apply it to the neck, to the shoulder, tennis elbow, forearm, carpal tunnel. We treat a lot of hamstring and quad injuries along with hip issues. The other applications that this gets applied to and helps provide pain relief is plantar fasciitis. That's a common condition where there's pain on the bottom of the foot. This is really one of the best ways to help reduce that swelling and inflammation without any negative side effects. This is another huge advantage of this modality, is there's no negative side effects. The only safety precaution we have to take is I'm going to wear protective sunglasses to protect my eyes in case I was to shine the laser right in my eyes or in the patient's eyes. But other than that, it's very safe, very effective, and we can do as little or as much as we need to. So depending on the patient's condition, if it's acute, we can do a little bit. If it's really chronic, it may need more visits. But on average, 4 to 8 visits of the laser therapy is what we'll utilize to get the patient out of pain and get them feeling better. Chronic conditions can last anywhere from 6 to 12 or even greater, depending on how long it's been. But again, this is a highly effective treatment that we use in our office to help get patients better faster.